Hi, doctor.
Hi, how did you?
I'm fine, thank you.
Yeah.
Can you give me this prescription, please?
Yeah, for sure, but please have a seat first.
Okay, I'm very busy now.
Yeah, I gotta not make you wait.
Okay.
So can I have your name, please?
My name is Mrs. Allison.
Mrs. Allison. Well, Mrs. Allison, my name is Dr. Manal Mohsen. Happy to serving you today. What's your age, Mrs. Allison?
I'm 35 years old.
35. Okay. I can see from your prescription that your doctor prescribed you glypride 5 milligram per day.
Yes.
Can you tell me what was your doctor diagnosis?
2 months ago, I went to my doctor for a regular checkup, and he diagnosed that I have onset diabetes. He told me that it is controllable by diet, but today he prescribed me a prescription. You know, I was very worried. You know.
Yeah.
Yes, it's first time for me to get a prescription.
Mrs. Allison, do you suffer from any other disease?
No.
Or you are not taking any other medication?
No, not at all.
Especially in this period?
No, not at all.
That's very well. What's your weight, Mrs. Allison?
I'm 68 kilograms.
That's very well. So I can see, obviously, you are so worried.
Yeah, very much.
First of all, I would like to say that there's nothing to worry about. Everything is okay. Everything can be controlled. But I can say something about your medication. Your doctor prescribed you this medication to help you lowering your blood glucose level. This is something that we call anti-diabetic medication. Do you have any other member in your family that's suffering from diabetes?
Yes. My grandpa had diabetes. Also, my uncle had diabetes. My cousin also had diabetes. You know.
Yeah.
And
so you obviously know it's something related to genetics.
Yes.
Yeah, of course. Well, any other member?
No.
That's very well.
No.
That's very well. Have your doctor asked you to make a blood glucose analysis?
Yes. I have actually.
Let me see.
Thank you.
That's very well.
Okay.
So it's slightly high, Mrs. Allison. It's not so high, but slightly high. We can control it by having the healthy lifestyle and also the medication on dates and on the right doses your doctor prescribed you. First of all, I would like to make a recommendation for your physician for another medication which will be more suitable for your case. You're gonna not take 2 medications, but it's an alternative for this medication. If your doctor say, okay, for this, we will continue taking it. If it's not okay, so we'll continue taking glypride 5 milligram. Okay, I will write it down for you. It's called metformin. This is very useful medication for lowering your blood glucose level and will be suitable for more for your case. Okay. So Mrs. Allison, do you usually have a lot of fats or carbohydrates every day?
No. Since my doctor told me that I have diabetes, I stopped all these things. You know.
That's very good, and I can also see that your weight is very good. So good for you. You are a good person, a healthy person. That's very good for any diabetic patients to have this optimal weight, and for also any other person that even he is suffering from diabetes or not. Obesity is a very bad thing, so we have to take care for this point. Okay. Now I would like to offer you a leaflet or a small brochure for type 2 diabetes you are suffering from. I would like to say also that there are different kinds of diabetes. You are suffering from type 2 diabetes, which can easily be controlled. Here you are. I would like you to have a look on this brochure. It will continue. It would contain a lot of information about your case. Your case can be controlled easily, but we have to take medications on time. We have to take care for your food every day, not to overeat fats, not to overeat carbohydrates, and also take your medication on time. That can make you very good. And also we may stop taking this medication forever.
Yeah. Okay. I hope so.
I hope so too. So, Mrs. Allison, did your doctor tell you about anything for your medication, glypride?
Yes, he told me that once I took it, I must eat immediately.
That's the point I wanted to talk to you about. There's something we call hypoglycemia. Hypoglycemia means that your blood sugar level is low, so you have to make something sweet always in your bag. If you feel that you are dizzy, if you feel that you are not able to focus on things, or feel that your vision is not clear, or having sweets on your face, so you have to eat something sweet, so you're gonna be fine. immediately.
Okay.
And also have an emergency call number that will
it's
help
not a
you.
serious. It's not a serious.
It's not a serious case.
Yeah.
It's just like some person who is not eating for many hours, so he feels that he cannot focus, that he is not strong enough. He feels that his body is fatigued. So that's a normal case, but we have to control it.
Okay.
Tell me, Mrs. Allison, if you have any other question, I'd be happily serving you today.
No, that's too much information to handle. But you give me this pamphlet, I will sure I will read. Yes.
I can see every time you need to ask me about anything. Yes. I also would like to say that after 13 days, I would like to see you one more time to make a refill for your medication. And also, if you have time, I would like to explain how to use glucometer.
No, I'm seriously have no time.
That's very well. There's no problem. But I would like you to see you tomorrow. If tomorrow is okay for you.
At what time?
Maybe at 6 time, 8 p.m.
6 p.m. Okay.
Yeah.
6 p.m.
Okay, that's very good. I'd like to see you to explain how to use glucometer because I'd like you to make your blood glucose analysis every 2 weeks, so we are sure that your blood glucose level is okay.
Okay.
Do you have any other questions?
No. Thank you very much.
Nice to meet you, Mr. Allison. I'd like to see you once more.
Okay, I will.
Thank you so much. Thank you.
Egyptian Pharmaceutical Students Federation. Since 1982, pharmacy is our passion.